meditating. The next day, she goes to the bathroom and the melanoma was gone. And I don't believe you. Come. When the doctor saw Jesus Christ, I never seen this in my life. So this woman healed herself by loving herself, sending love. And I know that this visualization or form of healing is very real. There is a person on the phone call. You are not... Susan. Susan is here. Susan, if you have any questions, you can ask your questions at any time. But what is the code to unmute people here? Star 5? Yes. To the okay.
5 star. To raise a hand?
Yes.
5 star.
What?
5 star.
5 star. Okay, Susan, if you want to have a question, press 5 and start, and I will see your hands raised. That means that you want to ask a question. Give me a minute. I want to see if anybody has a question here. And we move on with the next question. Is thermography an approved diagnosis tool? If not, can we still use it to rule out if a person has a breast cancer or not?
Thermography was approved by the FDA as a acceptable diagnostic tool when they did this in 1982 as an adjunct to mammography. In 1984, the FDA cleared this device for the use of diagnosis in several disorders and diseases, of which the disease of the breast was one. So it is an approved, recognized tool based upon the AMA's position in 1982 and the FDA's in 1984. It is, however, important that the audience understand that we, as thermographers, don't see lesions in the breast because this is a physiologic study. We are looking at the activity of the breast that may suggest changes consistent with a breast cancer. But unlike some of the other tests, we're not actually seeing something and saying, oh, that's breast cancer. So what we're actually doing is saying that the breast is not functioning properly and the malfunction may be consistent with a cancer. And now it's time to take another step forward and do some additional investigation to determine whether, in fact, those physiologic changes are compatible with breast cancer.
But we are able to find those or see those changes 7 to 10 years before a anatomic lesion or mass will appear, will become palpable or readable on a mammogram.
So as you know, Carlos, and we've talked about this before, cancer is the only disease in this country that we don't treat proactively. We wait until someone gets cancer and then we radiate it or we do surgery or we do chemotherapy. And the value of thermography, one of the many values of thermography, is that the physiologic changes tell us that there's a malfunction and allow for a woman or a man to make adjustments in his or her lifestyle, his and her diet, his and her activity, add or subtract whatever is important to do, and perhaps forestall or even prevent the formation of that cancer because we're 7 to 10 years ahead of the window when the anatomic test will find a cancer. So this is a proactive approach to breast health.
If you allow me, I will show a picture of a thermography. We can, I believe we can keep talking. Where is it? Okay, here we go. I will show you this. I posted yesterday in Facebook, and I think you will be able to see it. And you can explain to our audience what thermography does. Can you explain, because here we have areas of concern when it's red and when it's a normal tissue. Can you see it through Skype?
Can you see? Can you give a little bit of an explanation?
Yes.
What these particular pictures are visualizing is the color views of the breast from a different perspective. The top right picture is imaging both breasts at the same time. The other pictures are imaging the breast from a different angle. And what we are doing is we are utilizing color in these pictures to determine whether the breasts are symmetrical or not symmetrical. Most thermograms have associated temperature gradients in a statistical fashion that compares the numbers from one side to the other. So you're not just looking at colors, but you're also looking at data that goes along with the colors. And the idea being that the human body is symmetrical within reason. Nobody is a complete mirror image left side to right side. But if the pictures are symmetrical, meaning that one side falls within a range of approximately 1.5 centigrade degrees from left to right, then it is presumed to be symmetrical and therefore normal. And if it falls outside of that 1.5 degree range, then it is telling us that there's some kind of abnormality that needs further investigation, which is why when we do thermography, we talk directly to the people to determine whether they've had any trauma to the breast or anything that might be causing the abnormality. If not, we recognize that some additional investigation via physical examination and diagnostic testing is important.
Well, the other thing that for people who have never used this, I was very happy that yesterday when I was posting this in Facebook, a couple of women said I use thermography, is for people to know that, for example, if you do a follow-up on a woman's breast, if there is an area of concern in a mammogram, you can check here, and if the color is blue, means that it's cold, because cancer is a hot temperature tissue, and normal tissue is not as hot. So if you see that the color is blue or in the lower temperature, means that it's not a concern, but if you see a red like here, it could be an area of concern. I mean, this is what I understood. If you understand, if you could explain, elaborate on that.
He's asking for permission.
Right. Can you elaborate on that?
When you're using thermography as an adjunct to mammography, and I think that's the question.
The cool spots indicate that it would be normal if a hot spot would indicate the disease process.
Correct. Cancerous tumors generate heat because that's the mechanism for feeding a cancerous tumor. So it's called neoangiogenesis. It's the formation of new blood vessels intended to feed the tumor as it's growing. So when you see blood vessels that form, and you do that in black and white thermography, when you see the blood vessels that form and the additional heat that's evident on a thermographic image, it suggests to you that there is some acute, or perhaps not acute, situation that has necessitated the formation of these blood vessels and the concurrent heat that goes with them, and certainly sends up a red flag. If you happen to be looking at these with other testing, whether that be mammograms or ultrasounds and MRIs, you can correlate the heat with the anatomy to determine whether something that's being seen is pathologic or not. For example, if there was a mass on the mammogram, but the mass showed up cold on the thermogram, the indication would more probably than not be that this was not a cancerous lesion. And so it allows you to create a situation whereby you have less fear, because it is in all likelihood about 95% probability it's probably not cancer. So you have the best of both worlds. First of all, you can see the black and white and color images that are suggestive of abnormalities. And secondly, you can correlate it with additional testing before you put a needle in a breast.
Now, what I understand is mammograms detect cancer when it's already too late, when there has been many years. However, thermography has the capability to detect that heat that is not normal in a breast way before a mammogram can even detect anything.
Can you just say that one more time?
Yes.
The thermogram can detect it long before a mammogram.
But the reason is that the mammograms can detect calcification, and when a mammogram detects that calcification, is because it has been growing there for a long time. However, thermography can detect something that is not even a cancer, or maybe it's very small, just because of the temperature of that spot, way before the mammogram.
So the thermography can find things 7 to 10 years because of the sensitivity.
Because of the fact that the thermogram is so sensitive, And while not specific, it's sensitive, and the sensitivity will pick up the changes in blood vessels and the heat patterns. As Liesha said, 7 to 10 years earlier than a mammogram, we'll find a tumor the size of a pencil point. Even if someone finds a calcification on a mammogram, if it's not generating heat, the presumption then is it is probably benign and worth watching as opposed to worth sticking a needle into.
All right, let's move to another question. Why is thermography not covered under most insurance plans while mammography is covered?
This becomes a matter of insurance politics. There was one study done in the 1980s to validate thermography, and the study was so terribly flawed that it wasn't reproducible. And based upon that one study in the 1980s, the insurance industry came to the conclusion that thermography didn't work. And so despite the validation from the American Medical Association, despite the approval from the FDA, despite comments made by reputable sources about the validity of thermography and the waning faith in mammography, the insurance companies still call it experimental. And when you send them documentation from the FDA and the AMA that clearly state in so many words that it is not experimental, it is beyond the experimental stage, their answer is, well, for us it's experimental. The good news is that with more and more women being more and more awakened based upon knowledge and information coming from the internet, more and more insurance companies are starting to recognize that they're going to have to pay for this test. And so whereas 5 years ago the reimbursement was virtually nil, at this point in time the reimbursement from most insurance companies is about 30% of the carriers are reimbursing some of the clientele, some of the patients. And that's a big step forward considering where we were. And we're hoping that as more and more women look to this and as more and more literature comes out, we're going to have more and more reimbursement for the women and make it one of the mainstays of cancer, pre-cancer, breast health diagnosis.
Do you think if women demand or at least ask to their doctors, hey, I need to have a thermogram, can you ask the insurance to cover just for the insurance to start hearing that people want that will speed up the process?
Women are talking to their doctors and saying that they do want to have the thermogram, and they are coming up against a little bit of a pushback from some of the conventional doctors, although because so many women now are looking for thermography and wanting to do it, many more doctors are looking at it with an open mind. So they're starting to write scripts for it. I've had several women this week that came in with prescriptions for the thermogram. So I think that might be helpful in moving this forward for reimbursement. Now, I tell all of our people they'll be getting a claim form in with their packet. Fill it out, make a copy, send it off, and just see what happens. If you don't get reimbursed, at least the insurance company is starting to see these coming over very, very frequently. And as they do, then we get a little more move in the right direction. Even with Medicare. Medicare historically does not reimburse for it, but my Medicare people are just sending it in anyway, just to get a little bit of movement. So there is some change, but it's slow.
Yeah, but anyhow, in my opinion, if I have a wife, if I have two daughters, which I have 25 and 21, and there is a concern, we have to pay just $250 to do a thermogram. It's not that you are going to go bankruptcy like conventional medicine does. So if it's still not covered by insurance, it's not really a big problem because it's not that expensive.
Right, that's a very good point, Carlos. It isn't, I mean, in the scheme of things, thermography is very, very inexpensive. You know, like save your Starbucks money for a week and you can afford a thermogram. Or, you know, so you've got to have your priorities in order as to what you want, where you want to put your money. And if it means saving your life or saving the life of your daughter or your child, then that makes sense to me. It's money well spent. Exactly. You can't leave it up to the insurance industry.
Exactly, because as Philip said, this is a policy of the insurance. That doesn't mean that it's right. The policy is a policy. Anybody can make a policy. I work in a cancer clinic, integrated cancer treatment. We did hyperthermia, which is heating the tumor, and I know all about those policies. There is another very interesting question. My doctor has asked that I get a routine mammogram, although I am hesitant because last time I received a false positive. Here we go. Now that I know thermography exists, I was interested in doing that exam instead. However, I heard that a thermogram doesn't necessarily replace a mammogram. What is the best thing to do in the situation? It is better to go with a thermogram first and then the mammogram if something does show up? What would you suggest?
I think there's several questions here. The first one that needs elaboration is that a thermogram was never intended to replace a mammogram. It was intended to be a screening tool for breast disease, whereas mammograms were intended to be a diagnostic tool. So I think we're talking about two separate things, first and foremost. Secondly, we're dealing again with legality. We're dealing again with medical malpractice. We're dealing with a situation where, as I said earlier in our conversation, if you fail to stick to the standard of medical malpractice, and right now, unfortunately, mammograms are the standard of medical practice, you run the risk of lawsuits. So you have many, many doctors who may not necessarily believe that mammography is an answer, but they're operating under the premise that they're going to take no chances in terms of putting themselves in a position for a lawsuit, so they order them. There were research studies done back as far as the late 1950s and early 1960s that suggested that doing a thermogram before a mammogram made sense, because if the thermogram is normal, there's about a 95% likelihood that there's no breast disease or cancer or anything that suggests abnormalities. So in answer to the last part of the questions, I would absolutely suggest that they do a thermogram before a mammogram. And we never tell people not to have mammograms. If it's their choosing, if they want to do that, we try to educate them as to the latest statistics and information. Let them choose by themselves as to whether or not they feel that a mammogram is something they want to move forward and have. The last part of this question is, you mentioned in here false positives, and it really used to be a major problem in this country that we were worried about mammograms and false negatives. Because mammography at best is only about 60 or 65% accurate, and when you have a woman with dense breasts, which is about half of all women, that drops down to about 50%. So you have a test that really statistically is not a whole lot better than a coin flip. And so we worried for a long time about false negatives, mammograms missing breast cancers. Now the bigger problem has become false positives, where they're finding items, lesions that are so small as to be insignificant, especially calcifications, which, by the way, are actually called microcalcifications because they're only millimeters in size, and we're rushing women in for invasive treatment that they probably didn't need in the first place. So mammography now is giving you false positives, false negatives, a very low statistical yield, and which is why we say to women, if you want to have one, certainly, we're not going to tell you not to do it. But we recommend in an abnormal thermogram, start with an ultrasound because we've localized an area of concern. And if the ultrasound is still inconclusive, we try and advocate for breast MRIs, which are extremely sensitive and have no radiation or compression.
Do you think, I was just, as you were answering, I was thinking, can we do a compromise? Just have both mammograms and thermograms, and if they want ultrasound, have them all, and then make a decision?
Do them both, a thermogram and a mammogram.
Yes,
right.
like a standard procedure. Just do them both, right, because of the false negative of the mammograms, the accuracy of detecting inflammation, which is heat that may be a tumor. Instead of saying, yes, mammogram because it's approved by the insurance and the medical establishment, thermogram not because the insurance doesn't pay. Just do both as a standard procedure.
Right. I would think that if they could do a thermogram, right, and then if there's anything of question, if there's heat or concern in an area, then do a mammogram. If that's going to make the doctors feel comfortable and the insurance company feel comfortable, but make it for a medical necessity, not just every woman has to get one every year. Let's take a look at the thermogram. We're working together. I thought, if patient care is the goal, then let's work together on this. Better than that, let's do a thermogram and then an ultrasound. And then if you need to do a mammogram, then do the mammogram. But don't subject women to compression and radiation of their breasts over and over and over again.
Yeah, just because. And
for no reason.
Yeah, and regarding that, because many women don't know what is a thermography, but they know what is a mammography, compressing their breast. Can you explain to them how is the procedure? What is it that they do during the thermography?
Okay, would you explain the mammogram?
Well, mammography
No, the thermogram.
Oh, explain the thermogram,
yeah,
because they understand what a mammogram is.
Yes,
okay.
They know what is a mammogram, but they may not know what is a thermogram.
All right, well, a thermogram, as the technician, you would come into the thermographic room, which the temperature is kept at about 68, 69 degrees for thermographic purposes. The patient would disrobe from the waist up and acclimate to the room temperature for 10 minutes. And at that time, there's two female technicians on our staff, me and another technician. We're going over the paperwork while the woman is acclimating. It's very comfortable, very, calm, nice, soothing. And after the 10 minutes, we then do a 9 pictures in color where the woman is standing up. She does have her arms resting on top of her head like this. And we're taking 9 color pictures of the breast. So we're looking at the breast from every angle. Front, sides, under the arms, looking at the whole lymph section. And then we implement a cold challenge. So the woman would hold an ice pack for 1 minute between her hands. This stimulates blood flow into the breast, right? The hands are cold. The blood starts pumping to warm the hands up. So naturally, the blood is flowing through the breast. So we're taking the second set of pictures in black and white. It's lighting those blood vessels up for us to take a look at. We're taking the same pictures now, only in black and white. After that, the woman gets dressed. We, do the end closing up, and she's finished. The whole thing takes maybe 30 minutes. She's standing about 3 feet away from the camera. There's nothing that ever touches her. There's nothing that's compressing her. There's no radiation. It's completely non-contact and no contraindications.
It's a very pleasant diagnosis.
Most women say that it was an extremely pleasant experience because it's it's a wellness attitude, right?
Exactly.
And when I said the rooms are warm and comfortable, we make a very warm and comfortable place for a woman to come to so that they can feel good and not scared.
I don't know, Liesha and Philip, I don't know even one woman that does not have a stress. Actually, they tell me, I have to do a mammogram. I am stressed out. I've been postponing this for a month, for a year, because of the stress and the pain. So I am suggesting and proposing all women watching this, don't you think that instead of doing a mammogram once a year that is so stressing, bringing toxic energies on your bodies, spend $250 if the insurance doesn't cover, just for your peace of mind, or every other year? $250 a year is nothing. It's nothing, and it will give you so much information and the real peace of mind. Anyway, that's my collaboration to the conversation. I'm going to read a very long message that we received. And bear with me because it's really important to hear this. This woman says, I recently had my first mammogram. My doctor tricked me into doing it. It was so bad that in the time I took to get to my car, I was having chest pain with dry hives. I was called back for a second and I told my doctor I didn't want to go. He insisted. It came back telling me I had calcifications and has to have an immediate biopsy. I almost went, but I started doing research, including on your site. He's talking about the healing cancer in this century. I went back to my doctor, told him I will not go through with it and canceled the appointment. I have since done more research with your info and found out how many unnecessary biopsies are done. She watched your interview. The procedure is invasive and dangerous, talking about mammograms. Biopsies. I have had 3 arguments with my doctor telling him I feel he lied to me and deceived me just to get me into surgery. I found out that there is a numerical quota of biopsies. Each facility must perform a certain amount every month. I need to do a little interruption. I have a good friend of mine that works at Kaiser, and doctors play a competition who prescribe and complete more vaccinations, and the results is displayed in public. It's a real competition who makes more money on vaccinations. This is my opinion, it's not that. Each facility must perform a certain amount every month. My remaining problem is that my records now show me as a possible cancer patient when there is not really a reason. I would like to have these X-rays expunged. I don't know how to pronounce. Expunged. And I cannot, because I cannot right now call myself healthy because of the records. I have to return to my doctor because my BP, I don't know what is that, and heart rate has soared through its ordeal. This is the stress that they put her into. It's not that she's sick. And
it's your blood pressure.
Blood pressure, my BP. And I experienced headaches. My life was turned upside down due to this, and I am having trouble functioning day to day. Please help me with some much needed advice. Can you answer, can you tell her anything, this woman that is so desperate and under so much stress that we know that brings a lot of toxic emotions to her body that are the root cause of many health conditions? What can you tell this woman?
Send me one.
He wants to know what we can tell this woman. Did you understand and hear the question? Yeah. We can answer that now, Carlos, and maybe if you could send us the email, we can answer her at length, because there is a little bit of a difficulty in hearing the question
for
one Philip's part. So I don't want you to have to repeat the whole thing, but in a nutshell, she went for her first mammogram. She had a horrific experience, left there with chest pain and couldn't breathe, because it is that frightening for many women. And then she gets a call back for calcifications, and they want to do further testing and a biopsy, and she does not want to go through with that. So now her blood pressure and her heart rate are up. She's a nervous wreck. She can't function in her day-to-day life. She's scared to death, and she doesn't know what to do. That about sums it up. Philip, do you have any advice for this poor woman?
Well, I think that this is a story that we hear over and over and over again. Women go in, the compression, a couple of statistics. The compression of a mammogram is approximately 44 pounds. So for a woman listening to this, think about 3 bowling balls sitting on the breast. The nice soft breast tissue, 3 bowling balls, that's the compression, is 44 pounds. It takes about 30 pounds to rupture a capsule of a tumor. So if there is a tumor in the breast, we're about 33% above that, and it's almost certainly going to rupture the capsule and seed the tumor throughout the breast. So that's number one. Number two, the United States government has published documents that say that mammograms and other radiation devices, such as X-rays, are cancer-causing. They're carcinogenic. So we're now taking a woman, we're compressing her breast at 1/3 more pressure than it will take to rupture a cancer capsule, and we're giving her a test that is known to cause cancer to find out if she has cancer. So right there I could stop, and there's no logic to anything that I've just said, but this is what we do every day of every week. And then you go beyond that and you look at the statistics on microcalcifications, which we've talked about, and I'm not going to repeat. And then you have the fear factor of somebody says, oh my God, you have calcifications, and you know what that means, and the imagination begins and runs wild. So it's all about it's just one bad thing after another. It's a bad test with bad outcomes, with potentially harmful carcinogenic side effects. And then they send the woman home with this fear of, if you don't do something, my God, you could have cancer and die. So what we try to tell people is take a deep breath, read the medical literature, educate yourself, it's out there, decide what's best for you. Ultrasounds have no radiation or compression. MRIs have no radiation or compression. They're covered by insurance and doable. Thermograms we've talked at great length today about. And do some additional testing and decide whether or not, after all is said and done, it's something that really should be fear-inducing, or whether or not it's something that's just one of those things that you can go back in 6 months and have some additional testing and say, you know what, I'm going to change my life. I'm going to change my diet and lifestyle. I'm going to get healthier, and maybe when I go back 6 months from now, that calcification isn't even going to be there, because time and time again, we've seen thermographic evidence of improvement with those modifications of diet and lifestyle.
Well, that breaks my heart, because the example that you gave about the bowling balls, I mean, we as a men, we know how sensitive our breasts. And I am calling out all men to participate in this discussion. This discussion is not only for women. I want to tell something. When I was in the cancer clinic, we did hyperthermia here in the tumor. I remember 3 cases where these 3 women came from another state. And I remember the humble face of their husband. They came with their husbands. I knew later on that their husbands were MDs. Of course, if his wife is having a breast cancer, he doesn't want the breast to be removed. It makes no sense. And they have to maybe swallow their pride as an MD, leave it at the door, and the 3 women got healthy, and they were extremely grateful for that. So I need to see more women participating in this. This is not a conversation just for women. And women know exactly the sensitivity of the breast. How, and you know, if you are living, you have a wife, that your wife is stressed out to no avail, I don't know how to say, to so much every time of the years when from the office the doctor start telling them, do the mammogram, and they many times they get the woman tired and say, okay, I'm going to do it just because I don't want to hear you anymore. So
pressure from all sorts of outside sources, Carlos, from their doctors, sometimes from their families, and the doctors are berating them. Yeah. The radiologists are berating them. The nurses are berating them. So they're telling them, you know, what are you, crazy? You know, why don't you want to do this? You know, they're putting them on crazy, terrible guilt trips. We had a woman that comes to see us, and she actually got a letter from her doctor saying, if you don't get a mammogram, you're going to die. That's what she told. Now, thank God, the patient that received this letter was very thick-skinned, a very, very sure of herself woman, and she laughed about it. But other women, that would be devastating to. What? And so I love it when men bring their wives in to see me. They've done the research. They're driving. They're taking a day off from work, and they're bringing their wife because they're that concerned, and the love for their wife. And they know what's going on. So, and I also say to men, to give them an idea, our breasts are very tender parts of our body. Now, I say to men, you've got a couple of parts of your body that are very tender. I want you to think about compressing those tender parts of your body with 44 pounds of weight. And, of course, they cringe and they cross their legs and their hands come over their body but isn't that about the same, right? Would any man subject himself to a manogram or a testogram and have his tender body parts compressed and radiating? No. It wouldn't happen. It would never happen. Why are we doing it as women?
Well, I use that example all the time. And I want to tell you something. About 3 years ago, a friend of mine told me, Carlos, she was single, and um, I have to something on my, I don't know, left or right breast. Can you? I am scared to death. Can you go with me to see the doctor? I went as a friend, and then she told me later I just have to kiss, kissed. It's called so something cyst. Yes. So it was nothing. But what you said, every man should go with his wife or lover or girlfriend and participate on this. It's to everyone's interest.
Right. Or, I never thought of this, I just thought of this. What if a man went with his wife or loved one and watched her have a mammogram? Right? Wouldn't that end it right there? Because you might as well be putting your wife or loved one in a torture chamber.
Exactly.
It would take, that's what it would take for him to see what she has to go through.
And the worst thing, Liesha and Philip, when I was investigating and looking for pictures from mammograms, they used a picture of the big hospitals, a beautiful woman smiling or at least not doing like that, which is the real thing. So anyway, I would like to ask you one thing that in the interview we did before. When you're a Reiki practitioner and you know and you both know how stress, emotional trauma affects our health, does thermography somehow reflects that? Let's say that you see a thermography of a woman and then you start asking some question. Can you see that there was something stressing out, something, an emotional trauma in their life because of the showing of the thermogram?
I know what you're asking. So, in other words, the aura photography could show those sorts of things. So, the thermogram, Carlos is asking, when a woman is under stress, can we see that with the thermogram? Does that change the pictures?
It really doesn't, because what we're seeing is a manifestation of the heat patterns of the body. And if a woman is under stress, or if a woman is ill, the body will heat up uniformly. It doesn't heat up in part. So the whole body will heat up. So if there is a lack of symmetry, it's going to be persistent. It's just going to be amped up a little bit because of the stress or because of the illness or something like that. Because it's not one part. It's not like a contact thing. It's a generalization of it. So no, we can't see a change from that. Although if we did them serially, and you had one, let's say today and 3 months from now, and in that 3-month time frame there was a stress factor, you would see the overall acceleration of body heat from one time to another.
All right.
So we can't see it live as I'm doing the thermogram, but obviously we can see the results of ongoing stress if she were to come back in 3 months.
All right. And in your experience as an energy healer, Liesha, you mentioned when we did the interview last year that there is a change on something that you can perceive on the thermography. Let's say the woman receives a Reiki session, energy healing session, which is very, very calming to the cellular level, and then you do a thermography before and after. Is there anything that you can see, the difference?
Yes, I did a study with a woman. We treat people with something called complex regional pain syndrome, which is a debilitating chronic pain disorder. So I have a patient here, and she was willing to do a study with me. So it was over a 6-week period. I would do a thermogram, then I would do a 1-hour Reiki session on her, and then I would do another thermogram. I was doing a full body thermogram, so head to toe. She had problems with the complex regional pain syndrome in her hands and in her feet. After the first session, there was an improvement in her hands and her feet. In other words, they were more symmetrical, thermographically. As we progressed through the 6 weeks, it continued to get better and better and better, so that by the time we got to the 6th week, her hands were symmetrical, meaning one was not freezing cold and one was not burning hot before I even started doing the Reiki. Mm-hmm. So the Reiki was holding, and it was literally changing the physiology of what she had going on. and she continues to do well to this day.
So
and
that
comes for regular Reiki sessions.
so that's a beautiful, let's say, it's not a diagnosis, but it's a beautiful way to see of the efficiency of energy healing doing the mammogram before
Yes,
and
it was
after.
very validating for me
Validating.
and for the patient, because it's not me doing anything. She's taking part in this, and so because of her commitment and her belief in her healing, you know, she had the belief that she could heal, and that was what was happening. You know, I was just a conduit.
Exactly.
It was what was going on in her head and her heart that were making the change. I was just a vehicle.
That's fantastic. I love to hear that. Since we don't have any more questions, you know, it's very interesting. I want to share with you, all the people that were in Facebook or even in the call and even in the YouTube, there are no questions. And what I believe is because this is a new subject and they are just absorbing all this new information. And this is very, it's very important for my summit because this is a new information that everybody needs to know. So since there are no more questions, what can you tell a woman who goes to do a mammography or they feel a bump, a lump, and they are concerned? What will be the procedure? Oh, I want to mention this. When we have our first baby, I mean, before my wife was pregnant, and a week before of the delivery date, the due date, she lost all the fluid, amniotic fluid. And guess what? The nurses were calling every day, 2-3 times a day, saying, you have to come to do a C-section. And we didn't want to do it. And we were, of course, stressed out. But we were very firm that we didn't want to do that. So we went to see a man, very wise man, that told us, you know what, it's going to be all right. So we were firm, praying every day, we practiced meditation, and we got to the due date, and our baby was born naturally, without any problem. So I am telling this story because luckily I didn't have to go through a family member with cancer, except for my mom, and I know the procedure to rush people and to scare the hell out of them. I'm going to be very straightforward to make you do things that you don't want to do. So you need to take charge of your life. So if a woman, a young woman especially, in their 20s, 30s, or 40s, come with a lump or a possibility of some abnormality that could be a cyst, when they start introducing fear, the doctors, the nurses, what can you tell them? What is the procedure? Not to panic, and to what?
Well, since I'm the technician and I'm talking to them, I tell them not to panic. You're here doing a thermogram. That's a proactive thing to do. You're taking some control. Let's wait and see what the results are. You'll get the results. You get to talk to Dr. Getson, and we'll take it from there. But you need to, like I just asked them, if they can possibly just take a step back, breathe, meditate, pray, whatever it is that gets them calm. Go out in nature. I mean, it may sound silly, but these are the things that work. People are so disconnected from themselves. They are giving their power away left and right, and letting people make decisions about their life from a health standpoint, from every standpoint. And so they need to take responsibility for that and know that innately they have the answers inside of them. And they just need to be still enough to hear that, to listen, and to know that they'll be guided and led in the right direction. And they have to do whatever they can to stop listening to the fear mongers, even if it's their family members. So if they need to step away or whatever they need to do so that they can get quiet and get back in touch with who they are and the essence of their being and their health, that's what they have to do. That is priority number one. And then I also tell them, okay, if you have cysts, Many women have cysts. If you have fibrocystic breasts, here's some things that you can do. Dietary changes. Cut caffeine out. Get rid of alcohol. Get rid of the underwire bra. Stop wearing antiperspirant. There's many things. It's about empowerment. It's not about disempowering. We want women to know that they can take care of themselves. We want to empower them to do that.
Exactly.
Not to rely on me or Dr. Getson or anybody else to give them the answer. The answers are there. Go find them. You know, they're there. Go within. You can find the answers are there. There are many things that can be done.
Mm-hmm.
So, I don't know if that answers the question.
Of course, that answers the question. And there was something that the other reason is cancer grows usually very slowly, so there is no reason to rush.
Right.
Nothing will change to make a decision based on fear in a week or 2 or 3. You can take plenty of time to know what to do and take a second opinion, a third opinion, a fourth opinion, whatever you need, and you make the decision of it's your body. Philip, if you could add something else that you want to tell our audience.
You can add something else about that thought about, maybe a woman taking your time, and about the slow-growing breast cancers.
Excuse me. The cancers love sugar. So if you start by eliminating sugar, you've already forestalled some of the growth of cancer right away. I mean, when they do PET scans, they're using a sugar additive that they're injecting into the body, which goes right to the tumor. Many people don't know that. So if you empower a woman with knowledge, if you give her direction to where to look, you give her direction as to what the statistical evidence is, women will make the right choices inherently. I've been a practicing physician for a very long time, and women more so than men will listen to their bodies. They will be proactive in their health concerns, but a lot of them still operate, especially the older women, under the premise that the doctor says it must be true. And I don't think they recognize the external forces at work with medicine, such as lawyers, such as insurance companies, such as governmental agencies. And it may not even be what the doctor is thinking is right, but it's what the doctor's been told to say. So I think it's time for each and every individual, not just women, to understand what's best for them. As Liesha said, listen to your own body, educate yourself. Forums such as this one and the one we've done with you are just terrific for people to gain knowledge. And we applaud you for doing this because you're getting that information out to women and men, and you're allowing them to look beyond the constraints of their particular doctor's office and to be smarter about the choices that they make. Because right now, we're a sick society. We have so much going on with the foods that we eat and the air that we breathe and the pollutants that we're ingesting and inhaling every day. But the opportunity to become a healthy society is out there. And if each and every one of us as an individual takes steps toward health, one by one, it just changes the whole outlook moving forward.
Thank you very much. I just want to add that this interview or Q&A is time for my online video summit, Healing Cancer in this Century, which is beyond just finding new treatments that everybody knows that we have alternatives and other options. It's exploring new things like a thermography, exploring how stress, emotional traumas affects our health, and I invite you, especially people in Facebook, to go to the Healing Cancer in this Century. Just for signing up, you're going to receive 4 incredible gifts. 2 of them are group distance healings that I have about 1,200 people sign up on the group distance healing, are really incredible. They are better for me than for them because I feel so much energy. And after signing up, you're going to access 25 trailers of incredible interviews. Thank you so much, Liesha and Philip. It was really a fresh breath of air for all of us to have this information. The information how to contact Liesha and Dr. Getson is going to be in our website, so you can go there.
Carlos, just I want to say thank you for doing this, and thank you for providing what a supportive environment, right? That's what we need to do, is support each other, and that's what you're doing. You're providing a safe space with information and support. So thank you.
It's my pleasure. Thank you so much, and we are going to be doing this once in a while. Thank you, both of you.
Bye-bye.
Bye-bye.
Bye-bye.